Hi, this is Dr. David Zahaluk. I'm here with Leah Bevers. She's our billing specialist in-house, and we're going to talk today about things that patients can do to help to manage their healthcare costs related to using their health insurance. And there seems to be a trend recently for insurance companies to try and pass off charges to patients to pay them rather than paying them the insurance company paying them. And so we want to talk about things that you can do to stay proactive in controlling costs while you still get the best care. So Mia, for starters, before somebody starts to use their health insurance, when they get that card in the mail, talk about some of the things that they should know before they get started.
And they need to call and check and make sure when the actual effective date is, because it may not be effective for, say, the first or the next following month. And then that way they don't go to the doctor's office and are shocked when they don't have coverage yet.
That could be a big surprise.
Yeah. And then you've got families that you have both spouses that are insured, and so you need to make sure who's insured on whose plan, and then as well as which one is primary or secondary in that case.
And so, for example, if there's a working husband and wife and they've got kids, what plan are the kids covered under, and which one comes first and second? And most importantly, is there coverage for the kids?
Right.
Okay, good. And then what should they know about pre-existing conditions?
They should know if their plan actually has a pre-existing clause, and as far as how long the clause is, and what is covered in that clause.
Okay, so I think in general it's true though that if you go to work with one company, Company A, and it doesn't have any pre-existing clause, and then you go to work for another company without a long layoff, usually in that case, typically there's no issues with pre-existing.
Right, as long as there's no lapse in coverage.
Okay, good. Okay, and then talk about the different types of insurance for healthcare.
And there's several different types. The first type and most common is the PPO type, and that's where it's more of an open insurance where you can go to, or you can pick any physician you want, and you usually just have a copay and a deductible. But if you pick someone that's out of network, then you have a higher out-of-pocket expense, but it's still covered through your insurance. Then there's the QPOS and the POS, which those act like HMOs and PPOs, where you have a PPO benefit, or you can do it as an HMO and pick your primary care doctor and have them be like your gatekeeper and maintain everything, and you have less out-of-pocket expense. Then there's the HMO, where you have to pick your physician, and everything you have done, no matter what it is, it has to go through that primary care physician, and if it does not, then the insurance will not reimburse you if you pay out-of-pocket, and they will deny everything.
Okay, so basically you have HMO where you're selecting somebody who's a gatekeeper and everything must go through them, and usually you'll have in general lesser cost because you have less flexibility to see more people. You have PPO, which is more flexibility to see more providers, although they have to be in network, but usually you'll have to pay maybe a little bit higher, maybe a higher deductible. And then you have the POS and QPOS, which can act like either, so you have a choice when you select that as to how you use it.
Right.
Okay, and then I guess you have workers' comp and auto accident, but that's kind of self-explanatory, right?
Yes.
Okay. Before we finish up this video, and we're going to do this in parts so that everybody can get a chance to digest this. We don't want to give you too much all at once. Talk about handling referrals. What should patients know when they get a referral so that they don't get sticker shock associated with that?
Again, that kind of falls into the HMO, PPO types of insurances. If it's an HMO, you need to make sure that if your insurance requires an actual referral or an authorization number, and make sure that your physician, the one that they're sending them to, that your primary care physician has gotten that prior to sending you there, and that they send over your medical records and diagnoses for the reason for you seeing that physician, as well as any of your demographics and insurance, so that when you get there, everything is already taken care of.
We get that a lot, don't we, when when there's lack of clarity about the diagnosis that they were sent over for. Sometimes that can upset the card of the specialist getting paid, and then there may be charges owing back to the patient.
Right.
Okay.
Yeah. And on the HMO, they won't reimburse. It won't go back and reimburse. Whereas the PPO, you have more flexibility with that.
And then if there's a referral, let's say, for example, we made a referral to someone to see pain management, and then the pain management doctor wanted to do an injection. Talk about the facility and the provider being in-network or out-of-network, okay?
Just because the provider that's actually performing the procedure is in network does not necessarily mean that the facility that they're providing it at is in network. So if they're not doing it in their physical office and billing through their office, then you need to make sure that that facility is also in network, or you may have out-of-pocket expenses that you're not aware of.
So they could just check with the specialist, or they could check with the plan to make sure that the place where they're getting the procedure done is also an in-network
Right.
plan. Okay, good. Well, that's all we're going to do for right now. In the next upcoming video, we'll talk more about copays and coinsurances, deductibles, and out-of-pocket maximums, and then talk a little bit about how preventative visits might save you a lot of money. Thank you.